Hi, good morning. My name is Geoff Fleming. I am delighted to be here today. I really want to thank the foundation for inviting me and giving me this opportunity. It's really an honor to be among you. I wish we were all together in a room, but unfortunately our current status doesn't let any of us travel and gather like that. So who am I? I am a pediatric ICU physician. I happen to work at a major academic medical center in this country. I won't mention where because it's immaterial to this today, but I am a married father of three. I have been working in this space in academic medicine and end-of-life education and taking care of sick and dying children in a pediatric ICU for my whole career. And so it was with a bit of irony that in August of 2019, I was thrust to the other side of the bed, as I call it. I had a crick under my left shoulder blade, the kind you get from sitting on an airplane too long. And we couldn't figure out why and what it was. And my very astute wife said to me after 3 months of this that I should probably go see a physician and get some actual medical input. And I did, and we worked on it and it got better, but we could never figure out why it was there. And then I was taking my eldest to orientation at her university where she was going to be attending as a freshman. And I developed bone pain, metastatic bone pain. And that was something I had never experienced before, and it was different. And that prompted me to get imaged. And so my doctor imaged me, and I unfortunately read my own CT scan, which is something I will never do again. All of my images go through my oncologist before I ever look at them, because I want to hear what did she see and what is her plan with the information. But we're gonna put a picture up of my family. This is my family. This is my everything. My wife is next to me. My eldest daughter is on the left. My middle daughter is between my wife and the eldest, and then my youngest is out there on the end behind me. And these three young women and my wife are my everything. Amy, my wife, is a dean for student affairs in our School of Medicine. And Hannah, our eldest, is a first year at the University of Virginia, about to be a second year. Virginia and Delaney, the other two girls, are both at our local high school. And so, these are my everything. This is why I put up with chemotherapy and everything. I hear stories of long survival in our chat rooms, and I so want to have that because I really want to be here for graduations and to see them grow up and be young women. And I'm hopeful that that is going to happen, although our family has wrestled with the very realistic possibility that that may not happen. So anyway, I just wanted to show you that picture of my family, and we'll go back to the video. But those, I also had a substance abuse problem at the age of 18, and in a recovery program, I have practiced for 30 years this idea of living in the moment and living right now in this moment. I haven't done it perfectly. I'm maybe not even done it terribly well for a long time. But, when I got my diagnosis, I had a great sense of peace that, I had lived my life to full purpose, and that if this was the extent of the time I had wasted none of it. I had done everything I could with the time I had. And I bring that up because we are all living in a pandemic, and those of us that are getting chemotherapy are terrified that we're going to get novel coronavirus and succumb to it. And it's terrifying. And there's anxiety. We have cancer anxiety. We have scan anxiety, which I learned from my friends about, waiting for scan results. But we also have this coronavirus anxiety. And so one of the things I've been doing is to just pause in this moment and ask myself, am I okay right now in this moment? So, what I would say is for each of us to stop right in the second, right now, and take a deep breath and realize and recognize, are we okay in this moment? And some of us may even be facing horrible news, but are we okay in this moment? And right now, if you're watching this, chances are you're well enough to be able to sit and watch this. And that pause in the moment is something I do on a regular basis, whether I'm waiting for scan results or I've got a new pain that I'm worried about. A friend of mine that I connected with in the foundation really wanted me to share, what you shouldn't say to me. I've given this talk at my home institution to a group of clinicians, and I think as a society we've lost the knowledge of what to say to people when they are in difficult, dire emotional circumstances. And I'm sure many of you have experienced this. I've decided for me, one of the best things you can say to me is, "It's really great to see you today." And that is applicable whether I have cancer or not. And I sometimes say, "It's really great to be seen today." But I was laughing with my friend. One of the things one shouldn't say is to tell me about your uncle that almost made it. I cannot tell you how many of those stories people have come up, and I'm sure for you that's been the case as well. They come up and they tell us about the loved one they had that didn't quite make it. And really, I laugh. I didn't at the beginning. It used to really be difficult, but I laugh a bit now because they don't know what to say, and they're trying to say something. And this seems right coming out of them. But yeah, I don't know about you, but I really don't need to know about your loved one who almost made it. If you've got a long-term survival story, bring it on. But the uncle who almost made it. I've developed a little tagline. People say, "How are you at peace with this diagnosis at this stage in your life?" And I use Caring Bridge to communicate with friends and family. And I developed this little tagline that for me is really representative of how I've tried to live my life. And it is to love deeply, live passionately, and demand meaning and purpose in your life. And what you define or I define as meaning and purpose in my life is individualized. And it doesn't matter what the meaning or purpose is. It really matters that it's your meaning and purpose. And if we do that, I believe we can really have fulfilling lives. But I wanted to talk a little bit today about what have I learned as a patient about being a bedside physician. And I got to tell you, I thought I was pretty good at taking care of dying children. And I've had a lot of families tell me I'm good, but I forgot some things along the way that I've relearned as a patient. And so I'm speaking to an audience that I know is both patients and providers. And I hope there's a little something in here for everyone. The first I call the Google search. As patients, we know that when we get this kind of diagnosis and we talk to our friends and family, really well-meaning individuals come forward with a slew of potential things that will help us. Whether it is a specific diet. I've seen an ionized water that reportedly cures cancer. I've seen a book that says, read this and you can cure your metastatic cancer. I've seen and heard from individuals who've gone to clinics that are maybe what I might call, non-mainstream clinics who are touting really great results. And my intent is not to talk about any of those as good or bad. They're really, it's very individualized. But as a provider, families would bring me this kind of information. And I remember dismissing it. And really, I had this mantra that my MD was better than your Google search. And the part that I failed to remember and didn't know until I was going through it myself is these families have been brought this information by people they love and they trust, and they are desperate to make sure they've not left something uncovered. And this happened to me. I had colleagues in medicine bring me things that I wasn't quite sure what to believe scientifically. And I took all this to my oncologist and my palliative care physician. I went to see palliative care immediately upon diagnosis because it's a great thing to do. And I was able to pose these questions to my clinical team, and they were able to walk me through what might help, what might not help, those things they absolutely know are bad for me, those things that they don't really know whether it's good or bad, but it looks safe and maybe we should try it. And I really say that my first piece of advice to patients is, when you are brought these things by your friends and family and loved ones, they mean well and they want you to get better. And we need help interpreting this information. And to you, the providers, you probably do this well already, but sit with us and go through the options and be frank with us. Tell us what you know and what you don't know. We know that certain herbal supplements may interfere with other medications that we are taking. We need to know that information. And if we build that relationship where I can trust my provider to help me walk through this, all the better. I've adopted a term. I think we in medicine have gone from being owners of all the information to really being highly educated guides to a personalized experience, much like a docent in an art gallery who know about all the paintings, and they may ask me, what am I interested in? And they can walk me through and personalize my experience and make it more meaningful to me. And so what I would say to both us as patients and us as providers is we need to know that our patients are under this stress, and that our physicians have an opportunity to really help us and guide us. The next thing I want to talk about is, I call it the Bravery section. As a pediatric ICU physician, I learned this early from a senior partner. And I was able, a few years ago, I had a young man in the ICU who was on hospice and dying of a restrictive cardiomyopathy, which means his heart wouldn't stretch normally, and there was nothing we could do for him. And he was on hospice, and he loved Iron Man, the movies. And the new one came out, and one of our bedside nurses got a hold of a pirated copy and was going to play it in the children's theater in our hospital. And I really didn't want her to get brought up on federal piracy charges. And so I said, could we just send him to the movies? And she said, we could do that. And I said, sure, because I realized that sending him to the movies, what was the worst that was going to happen? And sending him to the movies became about the young man and not about me, not about what risk I was undertaking as a provider. And that's an extreme example. I had my diagnosis and a liver biopsy on the 2 day or 24 hours before I got on a plane to go to Scotland for a scheduled golf trip. I'm a golfer, and I was getting to go play the old course at St. Andrews. And my oncologist and my palliative care physician had the bravery, as did my wife, to let me get on a plane less than 24 hours after having had a liver biopsy. We didn't know what my diagnosis was, and I told them I was turning off all my communication with the medical center, and that when I got back, I was hers to do with as she needed. And she showed great bravery. It was nerve-wracking. She could so easily have said, we don't know what your tumor is. We need you to stay here until we figure that out, and let's postpone the golf trip. But she had the bravery to say, I hear you. We'll see you when you get back. And they gave me everything I needed for symptom management. So I guess my second message is, as patients, don't be afraid to ask. Talk with your providers. Talk with your medical team about what it is you want to do. What would you like to accomplish? And as providers, it's our job to sometimes say, I know this is risky, but this is really about the patient. And I'm sure you do this really well. And I had to learn it from my senior partners when I was coming up through the ranks. And I've seen it done in my own healthcare, and I can't tell you how meaningful it is to have that done. So, I'm at the end of the time I've been allotted, and I would love to sit and chat more. I know we're going to have some time in the question and answers, and there are no questions that are off limits. If I can't answer because it involves my wife's privacy, I'll let you know. But I would just say to all of us as patients, pause in the moment and ask ourselves, are we okay right at this second? And find our meaning and purpose now, whatever that is. And then don't be afraid to bring forward your questions and ideas to your team and build that relationship and have a discussion. And then we all need to be brave. Those of us that have a diagnosis need to be brave, and the providers that are caring for us need to be brave, because there's some important opportunities for us in this relationship. And so with that, I will say thank you. And it's been really an honor, and I look forward to the question and answer session. Thank you. Well, good morning. I'm looking in the chat box and I don't see any questions. I'm happy to answer questions. I am also perfectly capable of talking extemporaneously, and I'm happy to do so. But anybody have any thoughts or questions? How to respond when a neighbor tells you how much he was helped by a Rife machine. And I actually don't know what a Rife machine is. But I think it's interesting, sometimes patients have responses to therapeutics that even among a single diagnosis of cholangio, various genetic markers mean that one of you is in a trial that I can't be in because I don't have the same markers. And so, I think I have always taken what people said and asked them, what was your experience? Tell me about it. And then gone to my doctor and said, am I a candidate? Am I eligible? I mean, I will tell you, having looked through the agenda, there are therapeutics that I don't know anything about, and I don't think I'm a candidate for based on my Tempus screening. But I can tell you, my oncologist is going to get a lot of questions. So I see. Do you ever find yourself blaming for having done something in your past that could have led to your cholangio? I had fatty liver changes when I was 18. The oncology specialists can debate about whether or not that was what gave me cholangio. Now I've got a family history of ulcerative colitis. No, I look at this as biologic randomness, maybe some predisposition in my family to autoimmune disease. So I don't. I refuse to accept that there's anything I've done that led to this. I'm an upcoming family nurse practitioner. What would be your advice to me as a provider? Best way to react to a patient that just wants to give up? I think to ask why are they in a state where they feel like they have nothing left? And it may in fact be they really have nothing left, and that's okay. Telling people, oh, buck up, it'll be okay, I find is not terribly helpful to me, unless you are somebody who has lived through what I am living through. The messenger does matter. I would say explore with them. Let's see. How do you handle being in the medical field and newly diagnosed patient expect you to be a fountain of knowledge? I actually know nothing about my cancer. I rely solely on my oncology team. I usually cannot even name the drugs I am on. I certainly rarely can name the chemotherapeutic agents I'm on. I'm currently on a regimen that teclistamab and pertuzumab. I actually had to memorize that the other day. And so I try and get people to talk to me as though I don't know anything. And I think it's really important that we ask questions and we don't let people make assumptions about what we know and what we don't know. I love this. I often feel guilty for having a positive attitude about my journey. People expect me to be sad and depressed. How do you react? So I'm in a support group with some women who have horrible triple negative breast cancer, and they get drugs that make them sick as dogs. And they have a horrible time of it. And I feel guilty because at the beginning with Cisgem, Abraxane, I lost my taste buds. And I was fatigued, but I've never thrown up. I've never had any major sort of, I would say, horrible complications of my therapeutics. And I feel incredibly guilty for that at times, that I feel as though maybe I should be sicker. I kind of say, well, maybe that's the price for having a disease that can't be cured, is that the treatment maybe is a little bit gentler. And so I try not to feel guilty for having a positive attitude. I actually feel more guilty for those days when I don't have a positive attitude. Just so happens today is one of those days. I'm dealing with some aches and pains and bone mets, and I'm kind of tired of having to deal with these things. And I feel guilty today for not being more grateful for how good I actually feel. I want to be mindful of time and look through. It says, how do you prevent yourself from accessing and reading the literature with an MD's knowledge? For me, I know that that knowledge is not going to help me. You could tell me I have a 98% chance of survival. I would perseverate on the 2%. I know that about me. I have other colleagues that want to know everything, and that is their soothing piece is to dig deep into the knowledge. I trust my oncology team. You've heard me use the word docent, and I truly do. I ask questions. I read the international consensus. I didn't understand most of it. But I asked my oncologist, should I be on an aspirin? And we had that discussion. I try to bring forward ideas, but I don't pretend to understand what I'm dealing with. My world in the pediatric ICU is so far removed from what is happening here in terms of my biology and cancer. Can you share more about the support group? So early in our diagnosis, my family was steered to the Gilda's Club, which is a U.S. foundation for support of cancer on both the patient and the family. It was started around an individual patient who had, I believe, breast cancer, but is expanded to all cancer types. And my daughters and my wife, and actually my mother who lives with us, we all went to the Gilda's Club. So it was there that I've got my support group, which is a local group. We now meet remotely via Zoom. Have I experienced depression, and how do you overcome it? I have experienced certainly not the medical definition of depression, which is day after day, loss of appetite, loss of the desire to have fun. I have certainly had my down moments and days of dark, dreary mental attitude. I spend some time trying to find things for which I am grateful, things that are going well. And I try to focus on those, and I try and find the good in my life. It says, does your diagnosis impact how you might approach a PICU patient with a cancer diagnosis? I would say it would, except that I no longer get to practice. There's too much viral disease in the pediatric ICU, and so I don't practice anymore. And so I don't get to, but I have taken what I have learned at the bedside and tried to apply it in my own life here now as a patient. And you've heard me, I've made some assumptions or leaps of what I should have done as a provider now knowing what I know as a patient. And I wish, I have very few regrets in life. I would say really none. I would love to go back and perhaps be a slightly better provider or clinician to some of my patients by not dismissing their Google search or what their family brought them. But those are the mistakes that we all make as humans, and going forward. Let's see. I'm just looking to see if there's anything else. The second half of the question about the support group is, should I encourage this? So I will tell you, I did not think I needed a cancer support group. I'm a clinician. I've got a great family. I have a faith life. I have loads of friends that support me. I didn't think I needed a cancer support group. And how wrong I was, how absolutely wrong I was. It turns out there are things that I can say to my fellow travelers on this cancer journey that I can't say to even my family. Those of you who get chemo know some of the things I'm talking about. Those days where you get up and for that brief moment you think, I just can't do this anymore. And if you say that to your family, it can be a really sort of difficult emotional experience for them. And so, but my cancer buddies understand this. I have connected with some people in the cholangio world. I had a friend here in town who had cholangio, who unfortunately died suddenly at the end of May. And that was really hard because it was a fellow traveler, and now he was gone. And of course, it's very easy for me to project and see myself in that position. I've made a new friend in the cholangio world, who actually connected me with the foundation. And that's really important. But I don't know that it's vital that I have somebody in the cholangio world, as my sole source of support. There's a lot of similarity and shared experiences. My cancer friends happen to all have breast cancer, maybe simply because of the frequency in our population. But these women are brave and inspiring, and we text and we talk. COVID has really cramped our style in terms of getting together. And there's a reminder on the chat that there is a Facebook group for cholangio patients, and I'm on there. I scroll through, I share. Sometimes I don't always share every day, but I do think it is really important to have a group of individuals, at least for me, with whom I can share this experience. Sometimes it's advice about a medication. Sometimes it's just being able to say, I'm scared and I'm sad today. And to have a little cry with friends who understand. And I have those moments. I have those moments where I have a little cry. I had a moment recently when my friend with cholangio died, and I needed to share that with my cancer friends. And so it's a long way of answering, do you need a support group? I didn't think so, and I could not have been more wrong. I have absolutely needed a support group with whom to share, and all of us share in different ways. I'm very much an open book, as you can tell by the fact that I'm willing to get on here and talk on a Friday morning openly. But it doesn't matter whether we're very close and we have one person we can share with, or we're fairly open and we're comfortable sharing with a larger group. I think all of us need someone to connect to whom we can say things that maybe our loved ones are not well equipped to hear at that exact moment in time. Crying. Somebody said, thank you for talking about crying. So helpful. I have given a number of these presentations. I have cried in medical grand rounds at my institution. I have cried in a video to support our Gilda's Club. I have cried live in front of a group of people talking about this. It would be inauthentic of me to pretend that this is not a really, really hard journey. I did not at 49 expect to get a diagnosis that left me potentially with 12 to 18 months to live. My 12-month anniversary is coming up in August. I got to tell you, that's a little bit of a dark moment for me, in the sense that I wonder, well, do I only have 6-8 months left? Or, yay, I've made it past the 12 months. I've made it further than people thought I would make it. So I will be interested to see how I respond and react when I get there. We all know in this cholangio world that our diagnosis is a difficult one. There are many of us who have resectable disease and get to NED, and I am just so delighted. And there are some of us that may never get to NED, and I speak for my own case. I do not know that I will ever get to NED unless there's some miraculous therapeutic option on the horizon. But my job today is to enjoy the moment that I'm here, which is right now. And I'm going to do a little bit of work this morning, and then I am going from here to go to play golf. It's really hot in the part of the country I'm in, but we're going to have fun anyway. You mentioned shoulder pain before diagnosis. I heard that another time in this conference. Was that related to cholangio? Yes. What I had was a rib metastasis under my left shoulder blade that gave me muscle spasm at the area. And I had something called subscapular bursitis, which is an inflammation and irritation of the muscle under that shoulder blade. But we could never figure out why I had this, because nothing had changed. I was still going to yoga 4 days a week, and I was playing golf, and my activities hadn't changed. And in fact, it was exactly my bone metastasis. I've subsequently had that irradiated or radiated, and it's helped a bit, but I have daily pain under there, and it's been well identified both on CT and PET scan. I developed pain in my neck, and it turns out, my cervical spine lesion that I've got is now irritating muscle, and so I'm going to have that radiated. So I think the shoulder pain is really only, for me, related to bone disease, which is where my disease was metastatic to. Thank you. There have been lots of wonderful comments on here, and I'm very appreciative to all of you who I can't see in the audience. Somebody said, I appreciate the am I okay in this moment philosophy. It's easy to say and hard to do, but I practice it every day because, as I say to my daughters, let's not mourn what hasn't yet come to be. That doesn't mean we're going to pretend. That doesn't mean we are going to stick our heads in the sand. But at the same time, how do I find joy in the mundane? Which is, for me, meaning how do I sit at the dinner table with my family and just find joy in sitting at the dinner table? We don't have to put a huge amount of emotional baggage and burden on that moment. Can we just be here and enjoy life as it is right at this second? Very easy to say. I struggle when I'm facing scans that I'm worried won't be good. It's very easy to say, and it's very hard to do. And that is, but that is what I try and do every single day. It's, I think it is a very important tool. It's one I will continue to practice to ask myself, am I okay in this moment? Somebody just put into the chat about inflammation of the liver. Absolutely. So medically, when you have spleen, which is on your left, spleen irritation, you can get left shoulder pain. When you have liver irritation, you can get right shoulder pain. I didn't mention my shoulder pain was left. It didn't match my liver that was engorged with tumor. But you are absolutely right. Your father, Katie, I'm sure did have right shoulder pain related to the liver, and that would make sense. Well, I just see somebody put into the chat that they were given 12 to 18 months and they have 5 years. I have a freshman entering high school. I'm really hopeful I can see her graduate high school. I never thought I would be in a place where that's what I want. I just want to see my daughters graduate and become young adults. I hope for all of us that we can hit those milestones that are important to us. I'm not ready to go. I'm prepared to die if my time is now. But I'm not ready to go just yet. I've got a lot more things I'd like to do. And so for those of you who have reached a state where you have no evidence of disease, I am so delighted for you. And for me, I just hope that I can scrape out as many good years as possible. But the truth is that the only time I have is to live is right at this minute. Tomorrow is not here. I can sit here and worry about tomorrow, but it doesn't change tomorrow. And for me, it totally ruins today. It means that today I'm not going to get to enjoy because I will have filled it with thoughts of tomorrow. I've been trying to live my life that way for a long time. I think cholangio has focused that a little bit, but it certainly is not a dramatic frame shift for me. People said, what are you going to do differently now that you have this diagnosis? And I said, other than play a little more golf, nothing really. I'm going to keep doing and living my life the way it is because it has been very fulfilling thus far. I agree that our diagnoses put things in perspective for us. And what I would wish for all of us that have this diagnosis is that we are able to find serenity in the minute we are in, and that we are really grateful for the time we have. And also, I hope for you all that you feel as good a sense of peace over the life we've lived, because in the end, our lives that we've lived will be our lasting memory in our families and friends. And that is such a joy and an honor to be part of the lives of so many. I think you all are very kind. The comments in the chat box are really kind. I am happy to answer more questions, but I don't want to belabor any points and fill time for the sake of just filling time. I don't know that I have any other anything else that I would say other than I have a saying that I'm developing. For me, it's just a lug nut. Meaning, just when we get everything rolling along smoothly, we're on a regimen that we can tolerate, we know what to expect, things are going along, suddenly a lug nut on a tire comes loose and the wheel starts wobbling, and it's always something. That is the tagline for Gilda's Club. It's always something. And so I hope today for you, those of us that are patients, that our issues are minor and they really are just a lug nut. We tighten it up and we get the car back on the road. But the only thing predictable about my disease and my journey is that it is wholly unpredictable about what I will be facing next. And I hope for all of you have a great rest of the conference and a wonderful rest of your time. And I look forward to running into more of you in the future. And thank you. And I will, at that point, unless people have other questions, leave it at that.